Hi, I'm Melanie. I'm here to do a health assessment on a patient for cardiovascular and peripheral vascular systems. Hi, Marcy, I'm Melanie. How are you?
Good, how are you?
Good. I just wanted to ask you before we start if you have any history of chest pain, palpitations, shortness of breath, any fatigue, abdominal pain, low back pain, any pain in your legs, any notice of hair loss or tenderness anywhere? Okay, I just wanted to check if you have any risk factors for cardiovascular problems. That would include any diabetes, increased cholesterol, do you have high blood pressure? So any problem like with increased weight, obesity?
No.
Very good. Any history of smoking?
No.
Okay, so then we could begin. At first, when we're doing this exam, I'm going to keep you at a 30-degree level. So for cardiac exams, they like to have at a 30-degree angle, okay? So I just wanted to just take a quick look, okay? Your color looks good, it's symmetrical and even. I'll start with just taking a blood pressure. I'm going to have to do this on both arms. Okay, I'll just check your radial pulse first. Very good. I like to keep your arm at the same level of your heart. Okay, your systolic is 110 and your diastolic is 62. Let's see what it is on the other side. Sorry about that. Okay, and this side's 100 over 58. Okay, I just want to check your pulse. I'll check your radial pulse. Oh, it's bounding +2. I'm just looking at the clock. And it's about 60 beats per minute. Is that normal for you?
Yes.
Okay, very good. All right, I want to just start by inspecting your neck. We'll do the inspection from the top down, okay? I'm examining, looking at pulsations in your neck for your venous and carotid arteries and your jugular. First, I'll start with your internal and external jugular. So what I'm looking for is pulsations from your external jugular, because I'm going to measure your venous pressure, which is measured at the highest point of auscultation, which is where the jugular vein seems to disappear. Okay, the difference you can tell for pulsating for the jugular, if you press on it, you don't feel a pulse, whereas the carotid you do. So that's your carotid artery. I'm just going to ask you if you could face to that side. Okay. All right, so I see your a slight pulsation in the sternomastoid area over here. Okay, so what I'm going to do is I'm going to measure the venous pressure, which is for fluid overload, and it's usually the pressure of the atrium. So I'll start by, in centimeters, measuring from your sternal notch, okay, to the highest point of auscultation. which is where I see your jugular here, and it disappears. Okay. And that comes to 3 centimeters, which we add to the 4 centimeters, which is 7 centimeters of the venous jugular pressure, which is normal because anything over 9 centimeters they consider abnormal. I'm just going to visualize on the other side your both your carotid, if you could just look that way, and your jugular on this side. Okay, I visualize your carotid artery pulsating. Okay, and I see your venous on that side too. Okay. All right, so what I'm going to do is now I'm going to just palpate your carotid artery. I can see it pulsating on both sides. Now if you just look to the left, okay, I'm palpating your carotid artery. Okay, and what I'm going to do is I'm going to listen with the bell for any bruits or thrills, part of the stethoscope. Okay. Okay, now I'm just going to listen for it normally. I don't hear any humming, so there was no bruits or thrills. If there was any, then another way of checking would be to check your brachial pulse and have you flex it. Feel your pulse, and then listen to your carotid artery. Okay, sounds good. If you could just look this way to me, I'm just going to listen to your carotid artery on this side. Oops. Again, I'm going to use the bell side to check for the bruits and thrills. Okay, sounds good. It's important not to press on both sides of the carotids at the same time, because it could have a patient pass out by occluding both of the carotid arteries at the same time. All right, so that sounds good. So next I'm going to move down, if you don't mind, if I could just expose you a little bit over here. I'm going to inspect your chest area and your heart. So I'm just going to feel, all right. All right. And I'm going to ask you if you could turn to your side, because what I want to do is listen to your apical, the point of maximal impulse, which is the apical impulse. Right, which is in the 5th intercostal space. The point of maximal impulse. Okay. At this point, I hear the S1, which is the first sound, louder than the second sound. The S2 sound. The S2 sound you could hear much louder at the base. All right. I'm going to have you sit up so I could listen with the bell for any murmurs. If you could just take a deep breath, and then when you exhale, hold it. I'm sorry, thank you. I'm going to just palpate your carotid while I'm listening. This is valuable in timing the sound or a murmur. I'm also going to visualize to see if I could see the point of maximum impulse pulsating. Okay, I'm just going to ask you to lay back down. All right, so then what I'm going to do is I'm going to feel for any pulsations. Right there. And then I'm going to just make it a little more direct. also want to feel up here for any ventricular pulsations. Okay, I'm just going to listen while I feel. Okay, and I'm just going to feel down here too. Okay. All right, I'm just going to listen with the bell. This part will let me know if there's any kind of mitral stenosis or any problems with the S1 or S2 sounds. Okay. Sounds good. This also measures the tricuspid valve too, to listen if there's any differences in the sounds. I'm going to go back to using the diaphragm part of the stethoscope, and I'm going to listen for any mitral regurgitation. Up here, I'm going to listen for any aortic sounds. There's no difference in any of the sounds noted between the S1, S2, or S3, S4 sounds of the heart. And over here is the pulmonic area, which is at the base of the heart, where I hear the S2 sound louder than the S1 sound. Sounds great. Now what I'm going to do is just examine your abdomen. Okay, this is also part of a cardiac exam. So I'm checking for to see any pulsations with the aorta. Okay, now I'm going to listen. Okay, I'm also going to listen to the renal artery on your left side. Your renal artery on the right side. Very good. Your iliac artery. And your right iliac artery. All present, sounds great. All right, I just want to percuss the chest and the heart area. Very good. And just do some light pressure. I'm sorry, just want to check if there's any pulsatile masses or anything evident in the abdomen. Just a little bit deeper, firmer pushing. Okay. All right, so now I'm just going to check your arms, make sure they're symmetrical, that the color is normal and the color is equal. Your fingers look good. There's no ulcers. Capillary refill looks good. Okay, I'm just going to check the presence of your radial pulses on both sides. Okay, on this side, they're present and bounding, +2. I'm going to check your brachial pulse. Very good. And your other brachial pulse. Okay, I'm just going to check for subtrochlear lymph nodes. Feel anything present? Thank you. I'm sorry. Okay. I'm just going to do a little test. It's called the Allen's test, and I'm going to include the ulnar and radial arteries. Okay, and when I let go, you could see the blanching and the pinkness coming back in your hands. Okay. Okay, very good. Okay, so now I'm just going to work down onto your legs, if that's okay with you. All right, so what I'm going to do start is I'm just going to feel for a femoral pulse. I'm just noting the color is symmetrical, that there's no ulcers, pigmentation, discoloration, no ulcers on the feet. There doesn't look like any unhealed wounds. Just going to check your femoral pulse on this side too. Okay, I'm just going to check the femoral nose. I don't notice any distribution of hair. Looks equal, doesn't look like any hair loss. Color of the nail beds look good. All right, I'm just going to check your pedal pulse. And on this side. And I'll check your tibial pulses. Your feet both feel equal and warm. Skin texture looks good. I don't see any rashes, scars. Any tenderness anywhere? And anywhere that I pressed or touched?
No.
Okay, and just no edema. I'm checking. That's rated on a scale from 0 to 4. There's no edema present. You check with your thumb by pushing in these areas. And she's nothing. Okay, I just want to check for your popliteal pulsations on the artery in the back of your knee. That's present, bounding. This is also present and bounding. Okay, there's one last test. I'm going to just lower the bed for you. That we do. It's called the Trendelenburg test. Okay, so I need you to raise your legs 90 degrees if you're able to do that. Okay. Just let the blood drain out of them. And then what I'm going to do is block your saphenous venous pressure. and have you come over on this side and stand. Okay. Now let go. And I see how everything looks good. I just want to check your legs for any viscosities. Looks good. None present. Okay, that's it. Thank you very much.
You're welcome. Thank you.
Thank you.